You know, as a candidate for the Board of Supervisors, I said my highest priority was behavioral health issues. Issues of mental health and substance use and how we build out a better system. When I became chair of the board, I reiterated that commitment. And in the last 3 years, both since Supervisor Desmond and myself have joined here, our board has made significant increases in investment and funding. Every single year, year-over-year increases with our behavioral health department, our health and human services department, receiving significant movement. And it's not just about the dollars that get spent. It is an investment. It is about how do we design a system that works. Because when we know that when it comes to individuals who are in crisis, when it comes to individuals who are suffering from mental health illness or injury or substance use issues, the system is not set up to treat them well. If every one of us here today immediately broke your leg, we have a medical healthcare system that could get you in and get you an x-ray and a cast and get you home in time for dinner. But if everyone here today was in need of crisis stabilization and other services, it'd be awfully hard. Because we have a system that is designed to let you get to a point of crisis and then treat you at that highest acuity level, stabilize you, and then put you back out into the environment to await your next return to a level of crisis. And that's what we're trying to change at the county. And projects like this, crisis stabilization units, are a vital component. But this doesn't work without mobile crisis response team, which is moving. And then when we get you stabilized, we need the ongoing community care. Programs like our behavioral health impact or funding, we need that person-centered care coordination, particularly for our SMI population. And all of these pieces have to work together and come together. And I'm so grateful for all of the workers who do the difficult, hard work every single day. I had a chance to talk to some of the clinicians and nurses who will be staffing this facility, and it is difficult work and it is hard work. But it is so important. It is so important that we meet people where they are, that we get the right care to the right person at the right time and get the right outcomes. And if we all collectively come together and we do our job, we can lower that need for that crisis level care and we can help provide people with a pathway to a better life, but it requires us to do it a little bit different. And that's what we are working collaboratively at the Board of Supervisors to invest in, to build a better way to deliver behavioral health services. And it'll help with an array of issues from the unsheltered to the homeless to those that are in need. We have to simultaneously tackle the stigma around accessing services and cares. But the addition of this location, 16 recliners, and it's not just that, it's all the other services, the behavioral health assessment, the psychiatric services, the medication, the peer support, the transition planning, all that gets done really quickly in a short period of time. But that trust that you build and that connection into ongoing care is what I think is so essential. And this is not the only one we have going. We've got CSUs popping up all over the county. We've got a regional behavioral health hub that's popping up. We've got partnerships with providers. We are literally moving across the board and working really closely. I appreciate tremendously the work of Nick Mascione as the agency director. I appreciate the work of Dr. Luke Bergman, who you'll hear from in our behavioral health department and division. And I appreciate the work of each and all of you and what you do to help us. And it's also difficult to cite things. Everyone wants you to meet the needs of folks as long as you don't meet it anywhere near them. But the reality is that's not an option. And so putting these in locations like this, in a spread out across the region, working with our undersheriff, Kelly Martinez, who has brought a new approach, a significant investment in mental health, medication for addiction treatment, clinical services in our jails. We don't want you coming to jail, but if you come, we don't want you coming back. That is a vital component of what we're doing. What we're doing with Rady Children's Hospital to launch an entire hub to tackle adolescent issues. What our board did in taking federal ARPA funding and doing mental health screenings and assessments for every child in public schools and connecting them early, all of these things together, our harm reduction programs, our syringe service programs, all of the investments we are making across the board, I think are going to point us in a better direction as we move forward. We know it takes time. You all have been working on this one for a while. But tomorrow, those doors will open. And tomorrow, people will start getting help and care. And if we replicate what happens here in all aspects and areas of our county, I really believe we can make tremendous progress and really do a lot of good things. And so I want to thank everyone who is here. I want to thank Exodus Recovery for the tremendous work, not just here, but everything else that is happening and going on. I want to thank the residents and leaders of North County. I want to thank Supervisor Desmond. District Attorney Summer Steffen and her office have been great partners and allies and all of the things we're doing. And when you have the DA, when you have the sheriff, when you have your supervisors, your agency, your community leaders, your partners, all moving in the right direction, that's when we know we can make progress. And so it's a very, very, very exciting day, not just for us here, but across San Diego County, and I'm thrilled to join you.